Dr. Paul Offit, a vaccine expert at the Children's Hospital of Philadelphia and a member of the FDA's advisory panel. Dr. Offit, good morning to you. It's good to have you on a Saturday. First, I want to go back and ask you about the deadly surge in India right now. The U.S. is sending aid, vaccines, adding travel restrictions. Is that enough? But also help us understand the threat here at home if the virus continues to rage out of control on the other side of the world.
Well, I think when this virus rages out of control, the big concern is that you're going to start to create more and more variants, especially variants that would be immune to or resistant to immunity caused by natural infection or resistant to immunity caused by vaccination. That's the worry. I mean, we're not going to really slow the spread of this virus by restricting travel from India, but what we could do is decrease the possibility that a variant of concern would come into this country. So I think the Biden administration made the right decision.
I do want to turn to the vaccines now. Pfizer, as we mentioned in that report, is asking to expand emergency use authorization for its vaccine to include 12 to 15-year-olds. We're told the decision could come any day now. Are you confident that younger teens should be getting this vaccine now?
Yes. First of all, the study that was done by Pfizer involved about 2,200 people. 1,100 of these 12 to 15-year-olds got vaccinated. 1,100 didn't get vaccinated. There were 18 cases of disease, all in the placebo group. It was well tolerated and induced an excellent immune response. I mean, more than 3 million children have been infected with this virus in this country. About 200 have died. There's another disease called multisystem inflammatory disease in children that we certainly see in our hospital that may well cause longer-term effects. So certainly children will benefit from this vaccine. Yes.
That inflammatory disease, a lot of people have been concerned about that as well. I do want to turn, though, to New York City and other cities across the country have been talking about plans to fully reopen, some by July. But we've also seen states like Mississippi already dropping most restrictions, mask mandates starting to go away in some places. Are we ready for that?
Here's what worries me. This is essentially a winter virus. And if you look at what happened when the virus first came in last year in March and started killing people in the United States, it dramatically increased. 1,000 deaths a day, 2,000 deaths a day, 2,500 deaths a day. Then, as we approached April and May, the number of cases and deaths decreased to generally fewer than 1,000 deaths a day, even though the population was fully susceptible and even though there was no vaccine. Then we hit November and it took off again. 2,000, 3,000, 4,000 deaths a day because this is a winter virus. We need to get to 80% population immunity before next winter hits. That means we need at least 100 million more people to be vaccinated before next winter hits, because if we don't do that, then I think there may be a surge next winter. And I do worry that you're starting to see a drop-off in vaccinations. And as the summer goes on, people are going to get more and more complacent because this is at its heart still a winter virus. And people are going to think, great, it's over, I don't need a vaccine. But we need to get to 80% population immunity, by as we approach fall, because if not, I think we're going to be in trouble next winter.
It really is a delicate balancing act at this time. We mentioned earlier that you're on that FDA advisory panel. AstraZeneca says that they're taking longer than expected in submitting their vaccine for emergency use authorization. There have been a few delays with this vaccine here in the U.S. and a pause in Europe due to those rare blood clots like we saw with J&J. Do you see any red flags or concerns that Americans should consider whether this vaccine comes online here in the U.S.?
Well, again, so I really can't comment on the AstraZeneca vaccine until we look at all the data. Certainly, it's true that both the Johnson & Johnson vaccine and the AstraZeneca vaccine, which are basically made in the same way, which is a so-called replication defective adenovirus, have this very, very rare problem of blood clotting. But again, still, if you take a theoretical million people, for example, with the J&J vaccine who would have a severe blood clot, it would be about 1 per million. Whereas if you take a theoretical million people who are infected with COVID, 5,000 will die and many will be left with permanent harm. So these vaccines, still the benefits outweigh their risks, but there are small risks.
And quickly, you think it will be authorized, AstraZeneca, here in the U.S.?
Don't know.
Don't know. We'll have to stand by and wait for that. All right, Dr. Offit, thank you so much for your time. We appreciate it.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.